Welcome to our explainer. Today, we're diving into psilocybin. It's this incredible molecule with a really complex history and a future that's got everyone in the medical world talking. It's a pretty wild story. So, let's get right to the big question, the central puzzle, really. How can something be a Schedule 1 drug, in the same box as heroin, and at the same time be called a breakthrough therapy by the FDA? It just doesn't seem to add up, right? Well, that contradiction is exactly what we're going to unpack today. It's the key to understanding the whole story of psilocybin right now. Okay, so first things first, what is psilocybin? It's a naturally occurring compound. You can find it in more than 200 different species of mushrooms. Yeah, we're talking about magic mushrooms. But really, the magic part, it's all just fascinating chemistry. And here's something that's really interesting about it. Psilocybin is what's called a prodrug. That basically means, on its own, it's inactive. So when you ingest it, the psilocybin molecule itself doesn't actually do anything. It's like having a key that's not quite cut right. Your body has to step in and do a little chemical magic of its own to turn it into the thing that actually unlocks the effects in your brain. So, how does that happen? How does that little chemical change lead to such a profound experience? Let's follow the journey of this tiny molecule right into the brain. It's actually a pretty simple two-step process. You ingest the psilocybin, and then your body, specifically enzymes in your gut and liver, gets to work. They basically snip off a little piece of the molecule, a phosphate group. And when they do that, they convert psilocybin into its active form, psilocin. That's the molecule we're really interested in. Psilocin is the one that does all the heavy lifting in the brain. And this is where it all clicks. This is the secret to its power. Psilocin looks almost identical to serotonin. And if you know anything about brain chemistry, you know serotonin is a huge deal. It's the neurotransmitter that helps regulate things like your mood, happiness, anxiety, the whole shebang. Because psilocin is such a good copycat, it can slide right into the brain's serotonin receptors and activate them. It's like a chemical skeleton key for your brain's mood system. More specifically, psilocin zeroes in on one particular receptor, the serotonin 5-HT2A receptor. When it hits that receptor, it causes a major disruption in something called the default mode network, or DMN for short. So what's the DMN? Well, you can think of it as your brain's autopilot. It's the part that's humming along when you're thinking about yourself, daydreaming, or worrying about the future. Psilocybin basically quiets this network down, takes it offline for a bit, and that allows your brain to make all these new and unusual connections it normally wouldn't. Okay, so your brain's default mode network is offline, and it's making all these new connections. What does that actually feel like? Well, the answer is it's complicated, and it is anything but predictable. On the one hand, you have the potential for these incredibly positive, even profound experiences. We're talking about feelings of pure joy, major shifts in how you perceive the world, your sense of time just melting away. People report these deeply spiritual moments and an overwhelming feeling of connection to other people, to nature, to everything. It's no exaggeration to say that for some, it can be one of the most meaningful experiences of their entire lives. But there's the other side of the coin, the bad trip. And this can be absolutely terrifying. We're talking serious fear, anxiety, even panic attacks. And this isn't some rare fringe thing. I mean, get this. In one major study from Johns Hopkins, even in a perfectly safe and controlled setting, about a third of the people who got a high dose said they felt significant fear at some point. So yeah, this is a very real possibility. So what's the deciding factor? What makes it a good trip versus a bad one? Well, it turns out it's not just random chance. It really boils down to two critical things that researchers call set and setting. Set is your mindset. What you're thinking, how you're feeling, what your expectations are going in. And setting is your environment, the physical place you're in and the people you're with. These two things are absolutely crucial for shaping the entire experience. And this really shows you just how powerful that context can be. There was this famous experiment back in 1962, the Marsh Chapel experiment. They gave psilocybin to a group of divinity students right before a Good Friday service. The experience was so deeply spiritual for them that decades later, when they were surveyed, many of them still called it one of the absolute high points of their spiritual lives. That really tells you something, doesn't it? So to really get why we're in this weird place with psilocybin today, we have to look back at its history. And let me tell you, its journey through time is just as wild and unpredictable as the trips it can produce. I mean, think about this trajectory. For centuries, maybe even millennia, it was used in sacred rituals by cultures in Mesoamerica. Then, boom, 1958, A Swiss chemist named Albert Hofmann isolates the compound. His company starts selling it as a tool for psychiatric research. But then the 1960s happen, it gets out of the lab, gets swept up in the counterculture with Timothy Leary and all that, and that cultural panic leads directly to it being banned worldwide in 1971. That ban slammed the door on research for decades. It's really only in the last 20 years or so that scientists have started opening that door again.
And that brings us full circle right back to where we started. How do we make sense of this? On one hand, you have this strict legal status. On the other, you have all this incredible, promising science coming out. How do you square those two things?
Well, for starters, let's talk about risk. When scientists actually sit down and rank drugs based on the harm they cause both to the user and to others, psilocybin is consistently ranked way down at the very bottom of the list. And, this is really important, it doesn't cause physical dependence. You just don't get addicted to it in the way you do with so many other substances. And check out this number, 641. That's its therapeutic index. Now, what that means is it's a measure of safety, basically how much you'd have to take to overdose compared to an effective dose. A higher number is way better, and 641 is huge. To put that in perspective, aspirin is at 99, nicotine is just 21. So from a pure toxicity standpoint, it is remarkably safe.
But, maybe the most powerful evidence comes from the clinical trials for depression. In one major study, they put psilocybin therapy head-to-head with a standard, everyday antidepressant, and the results after just 6 weeks were, well, they were stunning. 57% of the people in the psilocybin group were in remission from their depression. That's more than double the rate for the standard antidepressant. Double.
And results like that are exactly what makes regulators like the FDA sit up and take notice. In 2018, they gave psilocybin breakthrough therapy designation. That's a big deal. It's the FDA officially saying, hey, this looks like it could be a massive improvement over what we currently have. And now, a final decision on whether it could become a prescription medicine, well, that's expected by the end of 2026.
So, in the end, we're left with this compound of pure contradiction, aren't we? It's a Schedule I drug that's also one of the safest. It's an ancient sacrament that's also a futuristic, cutting-edge therapy. As the research keeps pouring in and the laws slowly start to shift, the real question becomes a social one. What place will we, as a society, decide to make for this powerful, ancient compound?